Our first clinic in March was with Creighton dental students. They come here 4 times a year. Always come with a supervisor, with the exception of the March clinic. We have to reach out to Creighton graduates within the state of South Dakota to be their supervisor. This year we also acquired the Dentrix dental software program through Henry Schein as a donation, approximately $6,000 in value. The benefit that has provided us, the previous software that we had, dental software we had, was not very user-friendly. We had 42 different dentists come through our clinic, and out of the 42, only one office knew how to use that software program. So changing over to the Dentrix has been extremely beneficial in other offices coming through. Having that knowledge base to enter their own data, records management is a lot easier, I think a lot more clear and concise. So that's been a huge asset to the program. The other great asset we got this year is securing a new dental receptionist, administrative assistant. She wears many hats, but she's just a very engaging individual, quick to help out. I don't know if she's my right hand or my right brain, but she's been extremely positive asset to the program. June and July this year were quite busy. We'd had, I believe, 6 clinics from May 25th through July 16th, where we were very busy. Not only being busy, but just from the point that we changed over the dental software and us not knowing it that well. So that was a big challenge that we got through. We started a partnership with the University of Indiana. They came in the very end of June into July with 10 students. Out of those 10 students, one of the students here was actually a dentist who was enrolled in their resident prosthodontic program, which is fabrication of crowns, bridges, partials, and full dentures. While they were here, they fabricated 3 full sets of dentures for individuals here. They made numerous flippers, which are a temporary treatment partial, which is to just help give a full set of teeth in the front for individuals who've lost those. They're coming back in October for another 2 days. They're going to reevaluate the dentures and the partials that they provided at their previous clinic, and we're planning on them returning in the spring. Working on that relationship. We're trying to increase our lab capability so those prosthodontic residents, they can come more than just 1, possibly 5 at a time, where we could provide more sets of dentures in the few days that they're here. We have a returning dentist from Rhode Island coming in November. He was here for a week last year, had a great experience, and is returning again for another week in November. We have Creighton coming in October. One of the South Dakota state legislators, who's a dentist, is coming for 2 days in October. And then in December we have Creighton students returning again. We have reached out to the adult corrections facility here on the reservation. Currently, that facility is allowed 2 appointments per week for their inmates to be seen at Rosebud IHS Dental. Oftentimes, their inmates have to wait 4 to 6 weeks in order for them to go get a tooth looked at the dental clinic in Rosebud. So we've reached out twice now for inmates to come over and be seen on an emergent care basis, where we can take them out of pain and help them while they're incarcerated. We work with Sapaun Academy. Last year we saw all of the kids, did their checkups, cleanings, any restorative work that they needed. We took care of those. Now at the beginning of the school year, next week we'll be seeing all the students who brought in a consent, doing their initial evaluation and cleaning. Then if there's any treatment that needs to be done, we will let the parent know and go from there how best we can accomplish getting their services done. This year we are going to reach out to the parents of those Sapaun students and offer a day that they can come in if they'd like to bring themselves or their family members in. We don't want just the student to be healthy, we want to work on the family to be healthy as well. We have numerous providers that have contacted me outside of the state of South Dakota, West Virginia, North Carolina, Texas, California, that they're interested in the program. So I'm going to reach out to them in hopes that we can coordinate and confirm a clinic for them to come and volunteer. Britt, our new receptionist, has done an amazing job of not only day-to-day operations, but we've set up an online exit survey for all of the providers that have come through to give us feedback on what was good, what was bad, what we can work on, and just positive comments about their stay here. She's also put together an orientation package for the providers that come through prior to their arrival. The biggest challenge that we have is records management and documentation. So we've set up some really clear templates, information that is a must that we gather, and that we gather it and record it all in the same manner for accuracy, and if we were ever to get audited, we have all of our information that's necessary for each and every provider. The other challenge is people don't know how to run the program, so she has stepped up and made cheat sheets on all the different subjects that each provider will need to provide for that patient before they walk away. So that's been extremely helpful. As far as our upcoming fiscal year, I'd like to reach out to the University of South Dakota Dental Hygiene Department. They traditionally come here to the reservation in the summer months, that we would like to try to coordinate their efforts here to come to our facility and to provide them a community-based environment, and also to provide services to our patients. University of Indiana students, when they come in October, will be going to Sapaun and doing 2 different presentations, one to the younger age children on how to brush, brief overview of why you want to brush, and then with the older students it will get more into the etiology of how cavities start, inflammation in the gum tissue, kind of more science-based, and also briefly discuss careers in dentistry to the older students.